A renowned otologist and neurotologist from Turkey talks about his education and experience. Presently, his focus is ear, nose, and throat and oncology. This is a two-part video series. The procedures include tumor surgery, cochlear implantation, surgical treatment for chronic middle ear infection, and balance problems treatment.
I'm basically doing otologic and neurotologic procedures. One of them is the cochlear implantation. A cochlear implant is a device which is used for patients who are born deaf or lose their hearing at the very first period of their life. So they are very good candidates for cochlear implantation. What I mean is the severe hearing loss on both sides. So those patients cannot be able to develop language as well if they are not implanted at the early period. Cochlear implantation is a kind of miracle for such patients. We implant, and after implantation, a few months later we start educational therapy for those patients, just starting by kind of plays and then using music and some face-to-face programs, and try to develop a language for those patients. Another surgery that we use is the surgical treatment of chronic middle ear infections. We're using all kinds of technical development. Sometimes patient needs prosthesis, we have some new implantable devices for the restoration of hearing. So we have all kinds of new techniques and developments in the treatment of those patients. I also work on balance problems. Some patients have really severe recurrent balance problems, and which is resistant to medical therapy. Then we propose them surgery for the complete relief of their symptoms. One of the strongest sides of our hospital is we have a very good vestibular laboratory. Sometimes differential diagnosis of patients is not quite easy, so we use a lot of computer-based tests to understand which type of problems they have, either to select a good candidate for surgery. And I think the other important part that I should mention is the surgical field. We have navigation. Some patients may have frequent surgery which is not quite enough to have symptom relief period. For those who have anatomical problems during the last surgery, the best option is to use navigation, in which during the surgical field you can understand that you're quite far away from some vital structures, and you do exactly what you aim to do. So the other important aspect of our hospital is the navigational surgery we use. Yes, basically from Balkan countries, from Romania, Bulgaria, and the other small Balkan countries like Macedonia and Kosovo recently. And we have some new patients from Middle East, and also from a new field, a new development is the front Asia and the Asia. So we have US patients as well. I remember one of those who came here to have a nasal surgery. So he had a septoplasty, a reduction of hypertrophied concha, and after that we have some email contact, so that he has a very nice result of the surgery.
Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site medicaltourismco.com for a free quote